Sports can provide a lifetime of enjoyment, but many athletes' careers are cut short by injury. Recently, Illinois coaches, physical therapists, athletic trainers, community leaders, and families attended the first ever Youth Injury Prevention and Treatment Sports Summit at U.S. Cellular Field. It was the brainchild of Midwest Orthopaedics at Rush Physicians.
The focus was to get the information out to a broad spectrum of people, parents, coaches, athletic directors, athletic trainers, just making sure that people are aware so they know what to look out for as we get into the high school and fall sports seasons.
It's our real goal of this conference is to educate coaches, parents, athletes on these issues and to provide them with some take-home points.
The hope is each attendee of the Injury Prevention and Treatment Sports Summit was able to gather information and apply it to different ways in their everyday lives.
There's more kids focusing on one sport at an earlier age, which I don't think is very healthy. I think there's plenty of data out there that supports that. I think if kids were involved in multiple sports, and we try to really emphasize that at St. Ignatius, I think it would reduce the number of injuries because you're not using the repetitive motions in the same sport with the same muscle group.
To help get a nice strengthening and conditioning program for our kids will help prevent a lot of the stuff that they're talking about right now.
The doctors stress there could be a significant decrease in all types of sports injuries if parents, players, and coaches put into practice the injury and prevention guidelines and strategies they learned at the Sports Summit.
Listening to the guidelines that we have and following those guidelines, it's very important. Our goal is to keep your son or daughter in a sport for as long as they can. Our goal is not to limit them. And I think a lot of parents, forget that, and you're right. They think these kids are invincible, and the kids think that they're invincible, and then they're going to come in with injuries. That's the problem.